Professor, thanks very much for talking to us. I mean, first of all, happy Women's Day. And before we get into the hard stuff, perhaps a question on how you would be celebrating or marking Women's Day.
I mark it by just celebrating life and by remembering how my parents raised me, by encouraging me to know that no matter what my gender is, I had the capacity in me to reach for the sky. And that is exactly what I've done.
And this year's Women's Day certainly does come at a difficult time, Professor. So news being digested that the country may have seen its peak in terms of COVID-19 infections. Are you seeing any reflection of this trickle down into the intensive care units?
I was so hoping this wasn't going to be about COVID-19 and that we were going to talk about women's things, but here we go. Yes, we are starting to see the quiet, that unsettling quietness about the number of patients that has trickled down in what we call the COVID positive wards. A few weeks ago, we were being hammered left, right, and center with increasing numbers of patients where there was a pressure on beds. And right now, it has gone quiet. And I'm not saying quiet in that we're not seeing patients. They are trickling in. We are seeing the less sicker patients, but nevertheless, we are seeing patients that are requiring hospital care. And we are asking ourselves, is this it? Have we climbed the mountain top and are we on the down slope? Or is this the calm before the storm? And when we look at models that the modelers had done, this is what they had predicted for the month of July going into August. But modelers, they're never quite satisfied with their predictions coming true. Now they have to remodel and now start telling us, oh no, we'll see another peak in September, which is not good news to give to a healthcare worker.
Yeah, and
but right now it's working for us. We're managing.
And I suppose at that
Yes.
time, Professor, excuse me, I mean, we could bring the woman in here because so many of them are healthcare workers, and undoubtedly, from what you describe, it could be welcome news for them because they are undoubtedly fatigued and burned out, I would imagine.
Oh yeah, we've actually coined a new term. We're morally injured by the continued stress and trauma that we experience when we look after very sick patients with not a leeway of catching a breather. And this is continued stress on a continuous basis. And when the end comes, we are going to have to be debriefed and treated for post-traumatic stress disorder. And yes, you are right. Most of the healthcare workers are women. Our nurses, mostly of them are women. And it hurts one when in the process of fighting this pandemic, and in fact, in the process of fighting any health problem, you lose colleagues along the way to the disease. And yet you are expected to just continue to march on and continue as a strong soldier. And you just need to continue and keep focused, because the patients need you. You don't have time to process that one of you has fallen, two of you have fallen. We have lost colleagues along the way, and we only have a moment of silence to observe. Many women are being lost. Many women are becoming sick. and as soon as they get better, they're back on the work floor. And whoever coined the phrase that if you touch a woman, you touch a rock, actually had a lot of insight
Well,
in him or her.
undoubtedly that's
And I
the
suspect
case.
that the he.
Thanks very much indeed. It's a pity that we have the poor audio and video quality indeed, but point taken there. Thanks very much indeed.